Lister Army Hospital has one of only 4 clinical hyperbaric chambers in the military. Eric Johnston reports on a soldier wounded in Operation Desert Storm that has been brought to Fort Rucker for the special treatment.
That big metal capsule is what's called a hyperbaric chamber. It's used to help patients whose tissue won't heal properly on its own. It works by supplying pure oxygen to the patients at high pressure, forcing the vital oxygen into the tissue to speed the healing.
The hyperbaric chamber here at Fort Rucker is the only one of its kind in the Army. During Operation Desert Storm, they were on standby to treat possible injuries requiring hyperbaric therapy.
Private Chris Bush is the first such patient. He had stepped on a landmine in Kuwait and had to have part of his right foot amputated. When that didn't heal properly, doctors sent him here to try and save what's left of the foot.
The purpose in the case of Private Bush was the concern that if his wound did not heal, that they would have to do a further amputation. The possibility existed that he may actually lose his leg.
Bush has been through several treatments. Doctors can treat up to 5 patients at a time in the chamber. This time, doctors were also treating a diabetic ulcer and a recovering jaw cancer case. Outside, medical personnel closely monitor the oxygen and pressure levels.
But you can see the patients are doing fine as we descend.
You can feel it working for you, working on you. You know, it's not something that a doctor has to say, well, you're healing real well. You know you are because you can feel it.
When we took him into surgery a couple days ago, the leg looked excellent, well oxygenated, and I think his outlook will be excellent.
Fort Rucker has had the hyperbaric facility since 1987, treating military patients from all over the Southeast, plus a number of local civilian emergency cases. At Fort Rucker, Eric Johnston, WTVY News.
Hundreds of Fort Rucker soldiers are still in the Persian Gulf. They are members of the 229th Aviation Regiment and the 46th Engineers Battalion. Rucker officials are constantly being asked when the units will return. Public Affairs Officer Lieutenant Colonel Eric Jowers says it's still too soon to know exactly when the units will return, but both units are tentatively scheduled to return next month, possibly beginning the first week of April for the 229th. Farmers in the Wiregrass use a wide variety